Hello, and welcome to On the Issues with Public Citizen. I'm your host, Nick, and today I'm having a conversation with Peter Maybarduk, Public Citizen's Access to Medicines Director. Access to Medicines Group takes on the important work of challenging big pharma, working with the federal government on things like drug pricing legislation, and expanding access to medicines around the world. I hope you enjoy our conversation.
So, Peter, what do you do at Public Citizen?
I direct our Access to Medicines program, which is dedicated to helping communities around the world stand up to the pharmaceutical industry and challenge their governments to make medicine more affordable and accessible for everyone.
That's great. How long have you been doing this work?
About 15 years now.
Okay.
A Public Citizen for more than a decade.
That's great. Yeah. And so, what is one of the biggest wins or something you're most proud of your work here at Public Citizen?
I think we helped save many lives during the COVID emergency, encouraging governments to do more, provide vaccines to more people, dedicate more vaccines internationally when there was a critical shortage and most people worldwide weren't able to access vaccines, a kind of vaccine apartheid that took hold. We were able to move the Biden administration, I think, to buy many more vaccines, to be more engaged in the global conversation, to act a little earlier, not as soon as we would have hoped. And the benefits of that are going to grow with time. That particular scenario also led to a new consensus internationally where countries are going to be producing more of their own vaccines. There's going to be more regional manufacturing, more science deployed and technology deployed at a regional level so that every part of the world has a way to produce its own medicines, its own vaccines, and aren't caught in the same shortages that led to so many millions of deaths, really, over the past several years. So that's a big positive. And we were also able to help NIH, the National Institutes of Health, take more responsibility for the vaccine that they co-developed with Moderna, stand up to Moderna and say, actually, this is the result of public science. This is the result of federal scientists' work creating the world's most effective COVID vaccine.
Yeah, I think we hear that a lot, right? That a lot of the development of the COVID vaccines were effectively taxpayer dollars, right? That's sort of how we got to that vaccine. And I think people have a lot of questions of, well, is it fair that companies can profit billions and billions off of something that realistically was taxpayer funded from the start?
NIH Moderna in particular was a public-private partnership from the beginning. Federal scientists invented several of the key components of the vaccine and then worked with Moderna over a period of 4 years, and taxpayers funded the early stage, the late stage. We funded the clinical trials. 99% of the development of the Moderna vaccine was funded by U.S. taxpayers. So we ought to, at least in the end, have affordable prices. But Moderna is jacking up the price of that vaccine. So it's an area where there's quite a bit more work to be done. We also ought to be able to make the vaccine available to everyone internationally, regardless of their ability to pay. And those are rights that the U.S. government largely has under law, but is hesitant to exercise due to the power of the industry. We help them stand up, and we get a little further each time. We've helped change U.S. legislation as well. The Inflation Reduction Act is the product of 20 years of advocacy in the health community. Many, many people have been involved, but we helped it also be more aggressive than it would have been. Real negotiations instead of arbitration, more drugs under negotiation. This is the Biden administration's signature effort to make medicine affordable through Medicare, and it's the largest policy setback to the pharmaceutical industry in a generation, if not of all time. And Public Citizens played a pretty key role in helping it be as expansive as possible and saying, really, the public deserves a fair deal on drugs. We shouldn't just sit back while the industry dictates terms.
Now, with the price of the COVID vaccine, if we are successful in bringing that price down, do you ever worry that big pharma CEOs will be forced to buy less yachts or take fewer vacations?
Yeah, it keeps me up at night for sure. The returns, not just for CEOs, but for shareholders, and the whole executive compensation scheme is really it's really out of proportion and out of step with what the public needs. These are very profitable industries. They're running on a monopoly business model, so the business model really needs to be broken, because the idea today is that a company benefiting from taxpayer research subsidies will exclusively control a new medicine for a period for decades, and they find ways to extend it decades into the future by manipulating our laws. Make blockbuster profits while treatment is rationed, because the companies find that they make the highest profits selling at high prices to the few rather than affordable prices to the many. We don't get the best innovation this way either, because companies aren't incentivized to make drugs for the poor. They're not incentivized to make drugs against leishmaniasis or diseases that affect a majority of the world's population that does not have ability to pay. They're incentivized instead to produce the next modest improvement on hair loss or erectile dysfunction or something like that. So we're not getting the innovation we need. We're not getting the access that we need. A lot of folks are getting rich off it. But it's not a system that any sane person would build this way from the ground up. It's the product of decades of lobbying built on centuries, really, of totally unrelated laws that the industry has figured out how to corral in its interest. The goal is, how do we pay for the medical innovation that we need and ensure that everyone has access to it? And what we have is a system that protects monopoly power on the behalf of corporations, guarded by lobbyists, taking advantage of our broken electoral finance system. So we're, it's an awful long way away from a rational, and I don't think anyone would dispute that.
So you were recently quoted in an article that talked a little bit about countries that have started to fight back against Big Pharma. What does that fight kind of look like? What does it mean when those countries are sort of standing up for themselves?
Yeah, I'd say this is the other piece of the work of which I'm most proud, because it's a little less about us and it's about the people that we've met in the course of doing the work, and how brave and how intelligently and how diligently they apply their country's systems to stand up for the people in their lives. So right down the hall right now is Luz Moreno Umbacia, who's a lawyer that we met in Colombia 15 years ago. We've been working together that whole time to make AIDS drugs increasingly affordable for people in Colombia. And Colombia's just taken a big step, saying that it will issue what's called a compulsory license. It means that they're not letting the corporation that sells a key AIDS drug, dolutegravir, they're not letting that company just set the terms anymore, charge whatever price they want. They're going to buy generic medicine, generic equivalents of the same drug from the regional division of WHO, the Pan American Health Organization. They're going to start providing affordable treatment to Venezuelan migrants. They're going to make sure that their public dollars go further in providing health care for everyone. It just means that they're standing up to the patent power of this company that for years has just dictated what the prices will be. But countries have in their laws available powers that let the health agencies decide if they will stand up to pharma, if they'll take that step. So we've helped Colombia take that step through a very long partnership of technical assistance and advocacy assistance, talking to folks in the health ministries, talking to folks in the patent office about their rights, and then working together on campaign plans. So many years ago, Colombia started chipping away at this. It started regulating AIDS drug prices. It started importing affordable AIDS drugs from abroad. And after sort of a long period of building power together with these unbelievably effective and dedicated and honest advocates based in Colombia, they're going to take that next step and really say no to pharma and take the power back. So we're really proud of that, and it's an honor and a privilege to be able to work with folks like Luz and help them be in a position to lead, make the space for them to lead in their local and national contexts. So I really like that. I like the part of the job where we're empowering people who really have their country's best interest at heart and are willing to stand up and do what we can to support them in their advocacy.
Yeah, I mean, it must be incredibly inspiring to witness a group of people that are willing to take on some of the biggest players in one of the largest industries, at least in the United States economy, right? And you think of big pharma, that's quite literally a machine, right? That is only after its own self-interest and in growing its bottom line. So I can imagine it's really inspiring to see this group of people that says there is no fight too big when we're talking about saving lives.
Right. And you're standing up to one of the world's most powerful industries. You're standing up to one of the world's most powerful governments. In many cases, our government. Even when a lot of folks quite admire our government and our country. I think one of the most challenging parts for people can be standing up to those elements in their own country, of course, that are fighting out the other side. So it takes solidarity across borders and building communities that can sustain that sort of work and say, we're doing the right thing here, and it's going to take time. But if we work at it together, both health and justice are going to make progress in the end.
Moving on to something that's a little bit more local, Medicare is in the news. We have a lot of articles that are out right now talking about Medicare negotiating drug prices, prescription drug prices. What does that mean? And is there benefit not only for the people on Medicare, but also for people who might get their insurance through their job or through their parents?
Medicare is the world's largest drug purchaser, way over $100 billion every year. And unfortunately, when its prescription drug benefit was created, through really quite an amazing story of soft corruption, Medicare was prohibiting from negotiating prices for those drugs that it's going to be purchasing on behalf of all of us. So the drug companies, instead of getting accountability, they got a bigger market. And they take advantage of it. They exploit it. All the drugs that we're looking at bringing the prices down now are actually drugs that already should have been subject to generic competition. The companies have been finding ways to game the patent system to keep their monopoly extra years beyond what even is supposed to be written into the law. So what the Inflation Reduction Act does, what Medicare negotiation is about, is for the first time, the U.S. government, with all its power and resources, will sit across the table from those companies and say, here is what we think is a fair price that we're willing to pay, and talk about it. And they'll set a maximum fair price as well, so that the American public isn't taken advantage of. This is going to save another $100 billion. It can save more with time as the program gets more assertive and takes on more drugs. It's also got a lot of limitations. It doesn't kick in until a drug has been on the market for many years. And so these are, in most cases, already bonanza drugs for the companies, or they're not going to sort of lose any meaningful incentives because they've already made a killing off each of these drugs. It's going to help Medicare beneficiaries because it is paying for, well, there will be out-of-pocket cost caps. So in addition to saving the government money, people are going to have to pay less and aren't going to get into these sort of catastrophic situations in terms of what they have to pay out of pocket to pay for their drugs. It's also going to pay for an expansion of Medicare services across the board. So this is part of how we get the health care that seniors and others need, is by reducing the drug prices that cost the government so much. It's going to bring transparency to pricing a bit, so that the private payers and all of us with private insurance are going to start to see benefits from understanding what opaque drug prices actually are and the room that other payers in the private market have to push back against the drug corporation's power and start bringing those prices down their own way. But perhaps the most important thing is it's a huge win against an incredibly powerful industry that keeps abusing our laws and system. So it's proven that pharma can be beaten. And now that everyone can see that pharma can be beaten, there will be more victories. States and other federal programs are going to start clawing back what the pharmaceutical industry has taken from all of us and make medicines more affordable for everyone over time. Step by step, win by win, but a big signature victory like this is part of how we get there.
So effectively, on paper, you could say that a drug company, it makes sense that they get to profit for a certain period of time off of a drug because they've got to sort of recoup what they put into the research and development. But that is something that's being exploited, right? Like they're not only sort of like recouping their costs, but basically just then gaming the system to pad their bottom line.
We have to pay for innovation, but there's no relationship right now between prices and research and development costs. It's just whatever a company can get away with by extending its monopoly period as long and as far as possible. So that's not what we want. We want a system that pays rationally, that pays for the innovation we need and not more, that pays for the innovation we actually need, not things that are cosmetic or primarily to serve to pad pharma's Pat Pharma's bottom line.
So if we replaced every big pharma CEO with Susan Cole, the famous House clerk, do you think things would get any better?
Well, they need to be brought in line for sure, right? I mean, it feels sometimes like just a club of folks with too much money and too much power and not enough accountability, not enough rooting in what life is like for most of us. So yeah, something like that might help. But I guess the key lesson, is this is public policy, and we're making it just corporate policy, treating it as if like what happens in the boardroom is going to magically yield positive results for the rest of us. But we can actually make decisions about how we want to pay for medicines, what sort of medicines we need, and what's a fair price. And we can do that while still leaving an awful lot of room for the private sector to do what it does well. But that is not what's happening here, because it's not a competitive market. It's a monopoly market with rules just made by the lobbyists. So we're not getting very smart outcomes. There are other ways that we could pay for drugs. It doesn't have to be a monopoly. It could be a prize system. It could be, we already pay quite a bit in terms of research grants. So we can come up with any number of ways that we want to pay for medicine in the first place that are a little more tied to fair prices and the innovation that we want to see. Right now, we just give away the store and then protect the companies with the power of U.S. law for decades before we allow even competition to get into that market. So we have to be able to do better than that.
So what is sort of the next big thing or the current big thing that an everyday person could really care about when it comes to this work?
Well, we're going to make medicine more affordable, step by step. Each of these wins helps. Insulin is still too expensive for people without insurance. We've got that in our sights. We're preparing the world against pandemics so that vaccines are available more quickly in all parts of the world so that you don't have variants coming back and hitting people in the United States harder. And so we're protecting lives abroad. This is an area where there's a lot of room to keep making things better if we work with the affected communities and we give power back to health agencies. Right now, we've got too much health policy just being written by the corporations that stand to profit from it. We can empower the health agencies, we can empower our own health agencies and the communities that are affected so that the situation keeps getting better and we move forward for justice and for health together.
That's great. Well, Peter, thanks so much for your time. I really appreciate you chatting through this.